An important question is, how serious of a disease is MDS? Is it a type of cancer? And what is the prognosis for patients with this disease? Hematologists do refer to MDS as a type of cancer, and that is because MDS patients have a specific set of cells in the bone marrow that are growing abnormally. We call this a clone of cells, and we think of clonal disease as a type of a cancer, especially when it's impacting on the normal production of blood. The prognosis of MDS varies dramatically. There are some patients who have less than a year to live from the time of their diagnosis, and then there are other patients who may live 10 or 15 years or more with the disease. And so with such a broad range of prognosis, it's very important that the patients be thoroughly evaluated for all of the components that make up these prognostic scoring systems. If you have very low neutrophils, you may be at risk for infection. Very low platelet counts, at risk for developing bleeding, life-threatening bleeding. And in the anemia, even when severe, anemia can usually be treated with blood transfusions, so it rarely affects the prognosis by itself. It's very important to speak with your physician about your prognosis. It depends on the percentage of blasts. The more blasts you have, the more likely the disease is to evolve into acute myeloid leukemia. And when AML, or acute myeloid leukemia, arises from MDS, it can be extremely difficult to treat. And so we try to identify patients before the disease has become leukemic and treat them for the MDS, and ultimately do a stem cell transplant or a bone marrow transplant to try to cure the patient in the MDS phase of the disease before it evolves to acute leukemia. There are some patients who have a very mild anemia. A mild anemia without transfusions has a much better prognosis than a patient who requires frequent transfusions. And this relates to the underlying disease. A patient who needs regular blood cell transfusions has a bone marrow that is not functioning well at all, whereas a patient who has mild anemia and does not require a blood cell transfusion has a bone marrow that is functioning close to normally. We look at blood transfusion requirements, genetics, percent blasts, and also other diseases. Patients with MDS tend to be elderly, and if you have other diseases besides MDS, they can work together to impair your lifestyle and also your longevity.